All right, let's try this one again. I'm going to start from the top of this question just to make sure there is no confusion here. So this first question is about prioritization, and it is a ventilator question. So a lot of times you see ventilator in a question and it can freak you out. And we want to make sure that this is not something that trips you up on your test. So remember that as a new nurse, you are expected to know more about caring for your client than the machine. So we want to keep our focus on our client's safety, their airway, breathing, all of that. So with that in mind, we'll look at the question here. And we can see in our question, the client is receiving ventilation and we've got alarms going off. The nurse has checked the connections, but there is no obvious cause for our alarm. And the client is having some oxygen issues. So we need to determine what our next step is. So a little tip, before you read any of your options, we want to think about what we expect to see in a correct answer. With this question, we know our client is experiencing some respiratory distress, so we are not going to leave them, and we want to pick the option that quickly and effectively increases our oxygen level. Remember that the ET tube is our airway. So let's look at our options. The first option we have here is calling the respiratory therapist for help and hoping they take care of it. Secondly, we have sitting up our client and providing oxygen through a mask on the face. Next, we have adjusting ventilator settings. And lastly, we have disconnecting the machine and manually providing oxygen through the ET tube. So based on what we talked about earlier, I am going to pick my answer here. I am going to hit submit. And we will first look here at our image. So this image here is a great way to see what an ET tube looks like, as well as the different points. So I just want to point out really quickly here, when someone is receiving mechanical ventilation, this is going to be what we use to deliver the oxygen into the client and into their lungs. So we've got the tube here, and generally this is where you would connect to the ventilator, but if we are manually ventilating, we would use the bag here. And as you see, the tube is inserted, and an important thing that will come up in a second is this little inflated cuff on the trachea. This prevents air and fluid from coming in and out and keeps that tube situated here. Use this little balloon to inflate it, and this is how it stays in. So we are going to look at our options here. Exit out. We're going to zoom in so we can see. We can go back to the question as needed. So whenever we have a low tidal volume alarm with a ventilator, we know that the client is not receiving adequate oxygen, and that could be for a variety of reasons, but the only surefire way for our client to make sure we're getting that oxygen is to manually ventilate. So when we go through here, we can see that our low tidal volume alarms are often due to disconnections. Loose connections are a leak in our circuit, which would be our tubing, but we also can see this alarm because of changes in the client's breathing efforts, or if that cuff is not fully inflated and we have some air leakage. So once we troubleshoot and determine that there is not an obvious cause of the alarm, we want to make sure that this client is getting oxygen. So we're going to manually ventilate with the bag valve mask connected to high flow oxygen. If your browser is still blurry, we want you to go ahead and try to refresh and hop back on with us. We fixed our connections on our end, and we think it'll look much better if you do that. So looking at our incorrect options here, first off, calling the respiratory therapist, this would delay care. Our client is in distress and needs oxygen now. We don't know how long it would be until a respiratory therapist could come to the bedside, so we want to make sure that we are intervening quickly. Next up, non-rebreather mask would be ineffective in this client because they have that tracheal cuff I mentioned earlier. So with the tracheal cuff, oxygen coming in through the nostrils or the mouth isn't going to get into our lungs. So if we look here at the non-rebreather mask, we can see that this rests on the client's face, and while it can deliver a lot of oxygen, this is not something that would work well for our client with who is receiving mechanical ventilation. So Brings us next to our other option, which is increasing to 100% oxygen. While we want to get as much O2 into our client as we can, if the ventilator is not able to deliver the volumes that it's set at, it doesn't matter how much oxygen we put in, it's not going to do anything for our client. So at the end, we want to make sure we are ventilating, so we are going to manually give breaths with our bag valve device attached to some oxygen here. So at the bottom of all of our questions, we have the educational objective listed, and this is a really nice, just little concise summary of our rationale, the correct answer and everything. It's great to reference later and can be a good tool to put on a flashcard, anything like that. So in this case, we know that ventilators alarm when parameters such as our tidal volume are not being met, whether it's due to machine malfunction or a change in our client's status. As the nurse, you should try to troubleshoot any alarms for obvious causes and manually intervene with the bag valve resuscitator if there's no obvious causes that are found and our client is experiencing respiratory distress. So lastly, I want to point out right down here at the bottom, you can see this NCLEX-PN client need category of physiological adaptation. This is a really helpful tool because the NCLEX-PN creates the test plan for the NCLEX, and the test plan is like a blueprint. And within that, there are different categories. And the test plan helps us to see what categories have questions, the amount of questions from each category, all of that. So this item right here, physiological adaptation, lets us know where in that test plan it falls. And this is a great resource that is available to you that I would really suggest going and looking at. So also I would suggest this ET2 picture here would be great to put on one of our flashcards or within your notebook. You can add notes to it. Just really helpful to see the different components and the different pieces here of how this whole system works. So let's move on to the next question. All right, next up, we are going to look at a client who is experiencing acute asthma exacerbation. And this is an acid-base balance question. So I know as a student for me, these were tricky questions, and they are really confusing because you get overlapping lab values, terminology such as chemical formulas and different things like that can just be confusing and just a lot of information to remember. So we're going to try to help break this down a little bit today, and within that, hopefully give you not just the answers to this question, but help you answer other questions better. So we're going to look at this question here, and we have clients having a respiratory problem. They have high-pitched wheezing happening, so we know they have a pretty severe illness. So this question has an exhibit. I always like to read my question first, then look at the exhibit, so that way I know what I'm getting into. So let's go ahead and click this here. So from our exhibit, let me zoom in because it's a little small. We can see that the pH is elevated. Our CO2 here, which is also known as carbon dioxide, is low. And down here, we have bicarbonate, and it's slightly elevated. So our partial pressure of oxygen is a little on the low side, but this would be expected if a client is having an asthma exacerbation. It tells us that oxygen is not being properly pushed to the lungs, but in terms of determining acid-base imbalances, this is not an item or a value that we need to be seeing. So now that we have looked at those items, we're going to keep that in mind. So like I said, we've got elevated pH and we've got low CO2 and our bicarb is normal. So side note and tip, if you're unsure about what lab values you need to have memorized for NCLEX, they are pretty clearly listed on that test plan I just mentioned. And if you look, it does include ABG values, which we have here, arterial blood gas. So we want to make sure you know those. So a little test taking tip here, I always suggest use the question to answer the question. We know that this client's having an asthma exacerbation, which is respiratory. So most likely our answer is going to be either respiratory acidosis and alkalosis. So based on the information given, I'm going to go ahead and answer here. We're going to click submit. And here we can see our explanation. So there are only 4 of the primary acid-base imbalances. So this is nice because we're not trying to figure out all sorts of different diagnoses. We just have the 4 available here to us. So if we look here at our image, we can see how we got to primary respiratory alkalosis. But first, I want to go through our options here. So we had metabolic acidosis, which would imply that our client's body is too acidic, which means their pH is too low, and that would be a metabolic cause. This is not the case here. And same with number 2, metabolic alkalosis. Would be too much base, which would be a high pH, which we do have an elevated pH, but this is not metabolic. And then also we have our respiratory acidosis, which would be too acidic, but related to a respiratory cause. So looking at our options here in our image, I want to point out here, we have some great images here to help you really go down the flow chart and determine what you're looking for. So if you look down here at the bottom, we kind of give a little bit of a disclaimer that carbon dioxide and bicarb values can vary based on the source you pull from. So we want to use these numbers as kind of a baseline. Sometimes values can be slightly out of range, but they may not be as significant as others. So what's nice here is we can start with our pH and we can work our way down and compare the values that we have to here. So from our high pH and our low CO2, we know that we have primary respiratory alkalosis. So little study strategy for you. I'm going to zoom in so we can see this now. I like to use the acronym ROME when I'm answering the arterial blood gas questions. So ROME stands for respiratory, opposite, and metabolic equal. So this means that in respiratory conditions, our CO2 and pH are going to have inverse relationships. So when one goes up, the other goes down. But in metabolic conditions, our bicarb and our pH are always going to go up and down together. So using that, you can definitely answer these questions a little easier. So looking at our rationale here, the big thing with respiratory alkalosis is that we want to reverse the hypoxemia that's occurring with that. It is the priority because we want to make sure our organs are being perfused and the client is getting enough oxygen to sustain. So in these, usually we have hyperventilation occurring, and that can be from different causes. So we want to treat the cause. So if someone's having an asthma exacerbation, there may be an inhaler or breathing treatment. If they're having anxiety or pain, we may give medication to help relax them. So going through our options here, going through rationale, going through the steps of it, we want to evaluate our pH first, which here we see the pH greater than 7.45 indicates alkalosis. And then we look at our metabolic component. The bicarbonate, which is a base, is within normal range, so we know it's not metabolic. And then when we look at our respiratory component, we have CO2, which is acidic, is decreased, and brings us to respiratory alkalosis. So we'd also want to determine if there's any compensation present. This client is not experiencing any compensation. If the bicarbonate was to decrease, then they would be, but it is not, so therefore we know we are just in primary respiratory alkalosis. Important to note that the compensated respiratory alkalosis, which is also called secondary metabolic acidosis, is pretty uncommon because interventions are made quickly before the body has time to compensate. We want to make sure that oxygen is getting in as quickly as we can and that we are not causing our client to be more hypoxic than needed. So, educational objective, again, if the pH is less than 7.45, the bicarb is normal and carbon dioxide is decreased, we have respiratory alkalosis. So one more time, we'll point out down here, we've got our client need category, and that is reduction of risk potential. So you can use that to help study, especially if you notice you're missing certain items a lot. Look at this down here and see if you are having a common thread with these areas, and that can really help you. So again, we have many of these images available with the acid-base disorders, and I would definitely suggest putting them together in your notebook or something like that. Put notes on them so you can learn to recognize sources or learn to recognize conditions differently. So we're going to go ahead and move on to the next question. Okay. All right, so this next question, we have gotten so many of your student comments on this one, so we had to include it today. So this is a question about airborne precautions, and it's commonly missed because isolation precautions can be confusing and they overlap with one another in terms of materials needed often. And also, what you experience clinically is not always going to be the same as guidelines. So we want to make sure we are sticking with our guidelines when we are answering our questions. So in our question, we are given the diagnosis of active pulmonary tuberculosis. And we know that tuberculosis requires airborne precautions, so we want to consider the required PPE, or personal protective equipment. You may have heard that term before. So let's look at that. Little tip, remember that when we're looking at a question like this, we want to go by the guidelines set forth by regulatory agencies and not by personal experience. We need to take our question at face value and not read into it any further. So we need to note that this question is asking about routine care, and that means what is required only. We don't want to add or subtract anything from this. So going off of those, we are going to look at our options here. So first, the nurse could wear a gown, which would protect from bodily fluids. Second, goggles and face shields protect mucous membranes like the eyes, where there's a risk of splashing fluids onto healthcare workers, blood or other fluids. Number 3 here, hand washing, which prevents the spread of microorganisms from objects and between patients. Number 4, N95 particulate respirator would protect against little tiny airborne particles that are smaller than droplets and suspended in the air. And number 5, we have surgical mask, which protects the nurse from droplets in the air. So based on what I know about airborne precautions, I am going to pick my answers here. And we are going to submit. So let's go over to our explanation now. So first we have our lovely table. So I want you to notice here on our table, we've got some asterisks next to varicella and herpes zoster. And these are important to note because the state of the lesions that your client is experiencing would change your precautions that you're implementing. But with tuberculosis, it does not change. So the table shows us the required components of the precautions, which we see here are the N95 respirator, or a powered air purifying respirator if your facility has this, a negative pressure isolation room with a high efficiency particulate air filter, and as needed, emphasis on as needed here, if contact with bodily fluid is anticipated, clean gloves, disposable gown, goggles, face shield. So, and I want to note that these precautions would apply to someone who has a confirmed diagnosis or someone who is currently being tested, or the healthcare provider has set forth any precautions because they are concerned about a diagnosis. We want to treat them in terms of precautions as if it is positive until we know that it is not, just for the safety of everybody caring for them. So I'm going to try to zoom in a little here on our explanation. So looking at our rationale here. So when we talk about precautions, we know that hand washing is never going to be a wrong answer when it comes to transmission-based precautions. We always want to be cleaning our hands before we're caring for a client and after we care for a client. And also, we want to make sure we have an N95 on here. So I'm going to click and let you see a picture. This is just an example of one you may see in practice. These are going to be fit tested to make sure the seal is tight around your face and that the particulates are not entering. So close that. Zoom back so we can read here. So TB is spread as an airborne particle and not droplet, which is really important to note with the N95 and also with our negative pressure rooms. So aerosolized particles are so incredibly small and they can remain suspended in the air for hours. They can travel long distances. But when you look at something that would be a droplet, these are pretty large particles and they settle quickly. So it's really important with airborne that you have these extra steps in place to make sure that you are protecting yourself, other clients, and other coworkers. So looking at our incorrect options, first up we have gowns, and gowns are part of contact precautions. You could wear them if you anticipate splashing of bodily fluids, but again, this question is simply asking about the required elements for routine care. So looking at the next one, we also have goggles and face shields. These are useful when there's potential for spraying and splashing again because they protect the mucous membranes, but like I said, they are not part of the requirements for routine care. Lastly, the surgical mask. So this would be required for droplet precautions. And this option can trip up some students because according to guidelines, we do want to place a surgical mask on the client when they leave the room for a procedure. But we can't read into this question and try to figure out whether we're putting the mask on them or us or any of that because that's just not in the STEM. The question's not stating that, so we need to stick with what is there, which is precautions that are mandatory for the nurse. So looking at that, we'll look at our educational objective down here. So remember that airborne precautions require an N95 or greater mask in a negative pressure room, and you must always wash your hands before and after patient care. So again, if we look down here at our client need area, we can see that we are safety and infection control. And we have a couple different tables for different precautions, so these would be great to put together to compare and contrast all the different required elements. So let's move on to our fourth question here. So this one is a pediatric question, and these are commonly missed because pediatric questions just are intimidating in general, especially when you see a newborn. We know lab values and different things can just automatically be different. And also when we see congenital heart diseases, they're pretty complex, and especially when you get into complications of them. So we know there's a lot of expected findings when we're looking at a newborn who has a congenital heart disease that in any other newborn would not be normal, but they are considered expected in these clients. So differentiating between the two can be a little challenging, and we want to help you do that. So looking at our question, this patient has tetralogy of Fallot, which is a congenital heart disease. You'll commonly hear this in practice just called TET. And it is, knowing that it's present instantly tells us that perfusion is a concern for this client. So when we're looking at our options, we want to keep perfusion in mind. So a test taking tip we have for you is that this question uses the word priority we see here bolded. I'm going to make it just a little bigger for you. So we know, like I said, that all these options are realistic for this client to be experiencing, but we want to look at and evaluate which of these poses the greatest risk to our client in terms of their airway, their safety, all of those things. So we want to identify which of these is that. So based on what I know about this condition, I am going to select my answer here, and we will submit. So looking at our options and looking at our images here, let's see, I'm going to start with this image. So in this condition, we can see, here we've got some good colors to kind of help understand what's happening in our condition. So first I want to talk about the name tetralogy of Fallot, which that is the name of the person who discovered it. But tetralogy, more importantly here, tells us that there are 4 factors at play when we are looking at this condition. So I'm going to quickly go through these just so you can kind of understand a little more. First off, we have the pulmonary stenosis here. So if you see, this deoxygenated blood is not really getting its way out to the lungs to get that oxygen. We've got a lot of wall thickening and some weakened muscle, and it's just really hard for it to actually push out. Next, we have the right ventricular hypertrophy. And so if you look here, compared to this normal heart, we've got a lot of wall thickening, and it creates kind of a stiffened and enlarged wall. So our pumping is decreased in effectiveness, puts a strain on the muscle. And also, if you look here, there's just a lot less area for the blood, whereas over here, we've got more area. Next up, we have the ventricular septal defect, which basically just means that this oxygenated blood over here and this deoxygenated blood are mixing, where we get this purple. Normally, you would have the septum separating your ventricles, but here it's almost completely absent, and so we get a lot of mixing. Then the last component is the overriding aorta. So our normal aorta is positioned over the left ventricle, as you can see over here. But in this heart, it is positioned right over this defect here, the septal defect. And so all this deoxygenated blood mixes with this oxygenated and then is sent out to the body. So if you see here, we've got the nice and red, and here we've got this kind of pinky purple. So this just tells us that we are not pushing as much oxygen to our client as needed. So I'm going to go back and kind of look at our options here and why we picked what we picked. So first, looking at our options, we've got our elevated hematocrit. I'm going to zoom back in so you can see these while I go over them. And this means we have more red blood cells than normal. The second here is that when we're listening to the infant's heart with our stethoscope, we are hearing an extra sound that would not be heard in a heart that does not have TET. Third, we have that the newborn becomes tired during feedings because of the extra effort that's required. We know that newborns with this condition have a harder time meeting the oxygen demand due to the ineffective perfusion, so they just get tired. And number 4, they had gained less weight than expected since birth, again, related to the fact that they are just tired and not eating like you would expect. So I'm going to go back over here and look at our items. So we know that infants with TET experience chronic hypoxemia because of this increased deoxygenated blood flowing through their body. Let me zoom back in so you guys can see. And the body compensates by creating additional red blood cells because they carry oxygen. And this condition is known as polycythemia. So elevated hematocrit, which in this newborn would be greater than 65%, is our priority to report because this blood is very concentrated with red blood cells, which makes it thick and viscous. And that puts our client at risk for thrombus formation, which thrombus would be a clot. And when we have clots floating around, we have a pretty high risk of stroke. So we need to make sure this hematocrit level gets reduced so we can keep our client safe and prevent anything like that. So looking at our incorrect options here, again, these are all items we would expect to see in a newborn with this condition, but based on what was presented to us, we know that the elevated hematocrit is our priority. So first, I want to point you to the murmur. They're very characteristic of the condition and can actually be used to help diagnose disease upon newborn assessment. And so I'm going to show you a little video here that helps you see where in the heartbeat the murmur occurs, and this will let you kind of hear what it sounds like and see where it falls in. All right. All right, so I'm not going to play the whole thing because it just is the same thing for 30 seconds, but it's really helpful to see where that murmur is happening in the heart. And so we like to get to know that, and those videos can be helpful. We've got them for all the different extra heart sounds, murmurs, all of that. So when you get into practice, you actually know what you're listening to. So looking at options 3 and 4, so feedings just increase our oxygen demand, and that makes this infant quickly frustrated and tired, which in turn leads to poor weight gain. So let me zoom back for you. Usually these infants, until they can have a surgical repair, would have some sort of supplemental nutrition, so they could have fortified formula, they may have an NG tube placed. All depends on how much their fatigue is affecting them in terms of growth. So we'll peek at our educational objective again down here. And we know that clients with TET are at an increased risk for polycythemia because of the chronic hypoxemia that is happening. Their elevated hematocrit has to be reported because the thickened blood can lead to thrombus formation and potentially a stroke. So this question all boils down to looking ahead at lab values, different things going on in your client, and trying to prevent something that could happen. So we look at reduction of risk potential down here as our client need category, and that falls right into that. We want to prevent any issues from happening and reduce the risk of issues happening. So I really love this image. I know I keep saying that, but I think this is a really great one, especially if you're trying to remember the specific elements of tetralogy here. And the colors are really helpful to see too what exactly is going on and why it's such an issue that all of the blood is just kind of pulling together. So that was question 4. We're going to go on to our last question here. We've got one more select all that apply for you. So I'm going to zoom in for a second. This question has an exhibit 2. As I said earlier, I like to read my question first, look at my answers, kind of figure out what's going on before I peek at my exhibit so I don't overwhelm myself with that. So this question is commonly missed because it is about the thyroid, and thyroid questions can be really confusing, especially when you relate manifestations of it to our lab values. So especially with thyroid stimulating hormone or TSH, we know that the levels can be increased or decreased for both hypo or hyperthyroidism, depending on the cause, if it's primary, secondary, or whatever. Also, we see here we have a 6-item select all that apply, and I don't know about you, but adding that extra item just kind of makes it a little daunting, just a little more stressful for me. So we know that the NCLEX loves to ask about opposing conditions and contrasting items, so we want to help you prepare for that. So I'm going to click on our exhibit here. So we can see we have some more laboratory results. So we've got 3 tests here, 3 tests we'd expect to see when we are testing our TSH. TSH, T3, and T4, these would be pretty expected to look at. So we know here we've got reference ranges and we have results. Again, what I mentioned earlier about the test plan having the required lab values for you, if you look, you will notice that these 3 are not in there, and we know that, but we like to have a good mix in our question bank of items that would just simply say increased or decreased versus items that would actually have a reference range. Because when you get into practice, you are going to need to interpret things yourself, and we want to make sure this is real world applicable to you and not just testing on itself. So if we look at our options here, we can see our thyroid stimulating hormone is pretty high. We know 4.2 is the upper limit, and we are pretty much double that. We look at our total T3 here, and we have a nice low value. And we look at our free T4, and again, a pretty low value compared to our reference range. So based on this, let's look at our options. So this question first needs us to identify the condition that the client is experiencing, and then we need to from there determine what the appropriate clinical manifestations are for the condition. So looking at that, a little tip for you to make SATAs more approachable. Select all that apply, SATA, I'm sure you know that phrase. I like to look at each option as kind of its own little true or false statement here. And so if I look at an option and I say, that's false, I can just click it, make it go away. So that helps me break it up into more manageable pieces. It's a lot easier to look at 6 small questions for me than this one giant one. So based on these laboratory results, we know this client is either experiencing hypo or hyperthyroidism. So we're going to look at our option choices here and see what we think matches up. So option-wise, we've got 6 here, so let's go through it. So based on our results, we could have low heart rate, temperature sensitivity, difficulty in having a bowel movement, hair loss from anywhere on our body. We've got constantly perspiring and hot or losing weight. So based on what I know about my conditions and my lab values, I'm going to go ahead and click a couple. And so again, would bradycardia be true or false for these lab values? Cold intolerance, etc. So going to pick the options that I think are correct, and we will submit. So I'm going to look at our table. Now, if we look at this table here, we can see that our client is experiencing hypothyroidism. So this table here is great. Again, we have one of these for hyperthyroidism as well, but we like to kind of break things up so you can see. So with hypothyroidism, we want to think about how everything really manifests as just slow metabolic processes. Everything is just a little sluggish, a little slow, a little weak. And so looking at here, we've got the generalized slowing, which we saw a lot of these in our option choices. And we also can see over here, some lovely big words. So mucopolysaccharide accumulation, you may be like, what in the world is that? So don't worry, I'll help you. Mucopolysaccharides are long chains of sugar molecules, and these help build connective tissues and cushion joints. They require thyroxine, which if we look on our client's lab values, is not super readily available right now. They require that to break down, and unfortunately they can't be broken down because we don't have enough of that hormone. And so they end up attracting water, which leads to swelling and can lead to pulling that water from certain areas. So, you've got coarse, dry skin in some areas, but you're going to have non-pitting edema in others. And that's also where we get that enlarged tongue of the macroglossia, because that connective tissue is really just attracting all of the fluid. So we also can have depression and some other things going on because all of our systems are just kind of slowed. So let's look at our explanation, and I'm going to try to help you kind of demystify the thyroid questions here. So like I said earlier, it can be confusing because we know that in thyroid problems, we can have TSH be higher or lower, depending if it's primary, secondary, all of this. So when I look at these questions, the best way for me to determine if a client is experiencing hyperthyroidism or hypothyroidism is really to look at our T3 and our T4 values. These are always going to be low with hypo and high with hyper. So our value was pretty low here. So we know we should be looking for the slow, sluggish manifestations of hypothyroidism. So if we'll look one more time here, we can see our T3 was pretty low. It's 30, should be at least 70. And our T4, our free T4, is 0.2, should be at least 0.8. So we know we are pretty low there. So we will zoom back in. So if we look at our image here, what's happening in this condition is that the thyroid stimulating hormone is not really getting a response. It is telling the body, make more thyroid hormone, make more, but nothing's happening. And so it's going to keep sending out, and that's why it's elevated, but our other level is low. So if you look at this image here, let me get this going. So this is kind of a complicated way to explain it, but essentially it's going to try to encourage production here. And, when there is a miscommunication or for whatever reason an ineffective transmission, we're just not going to end up with actual production of the hormone. So we know that our thyroid hormones act in body sites to stimulate and increase metabolic functions. So if we have low circulating hormone, we know that we are going to have decreased functions, as I mentioned earlier. So looking at that and looking at our other options that we have, we know that bradycardia, cold intolerance, constipation, and hair loss are manifestations of the slowed processes. So our incorrect options here would be the warm, moist skin and the weight loss, because these are signs of an increased metabolic rate, which we would see with hyperthyroidism. Instead, with these clients, we would expect to see weight gain as well as the dry, fragile skin that was mentioned up in that chart. So looking at our educational objective on this last question here, we know that primary hypothyroidism is marked by a high TSH and low T3 and T4. It ends up manifesting as slow and sluggish metabolic processes in the body. And we can tell from that we have physiological adaptation as our client need category. And again, with the table, always say put these on a flashcard, put these in a notebook. We know that these can be really helpful when you're just trying to get some quick information, trying to get those facts in your brain for studying. So with that in mind, that is our last question. So now we are going to switch over to taking some of your questions that you guys have been submitting. And yeah. All right. So First off, I want to review our test taking tips that we went over today. So forgive me, I'm going to be peeking at some of the ones I've written down. I've got my questions coming in over here. So first off, we had from the first question, if it's helpful, I can go back into the bank or go back to the items and look at them. I'll review. Okay. So we'll go back here, even though we've already answered, just to remind you of our strategies. So in our first question, we talked about, before we read our options, we want to think about what we're expecting to see in a correct answer. So in this case, this question was, what option allows us to stay with the client and quickly intervene and protect their airway, which in this case, our airway is the endotracheal tube. And so that was option 4, manually ventilating with the bag valve mask attached to the endotracheal tube. Looking at our second question here, our little tip was to use our question to answer the question. So in this question, the STEM told us that we have a client with acute asthma exacerbation. So based on that, we can pretty much rule out metabolic acidosis and metabolic alkalosis because we know this is a respiratory condition. And I did want to point out here that with how I can cross these items out and also just the general view of the UWorld platform, we try to mimic the NCLEX as close as possible. Someone who's taken it, I can verify this is pretty close. These are the same colors that are used, somewhat similar in font and look, as well as your calculator options, your notes, all of those things, and even the crossing out of items is something you can do as well. So, reminder on number 3 here. Our tip was to remember to follow the guidelines put forth by your regulatory agencies. So this can be for US or Canada. This could also be for other agencies that are putting forth information. We need to go by that. We need to go by our textbooks and never go by our personal experiences. We want to take a question at face value and not read into it any further. I know it's really tempting to try to figure out what's going on, but with questions asked that are like this, or just with any question, we don't want to read into it and add our own information. We want to strictly use what they've given us to answer the question and not add anything into it. So our next one, this was a priority question, which if you notice, we've got the bolded element here to help you remember that. So remember that in a question like this, all of our options are realistic. So in these kinds of questions, we want to look for issues that pose the greatest risk to our client. So even though these are all realistic in an infant with TET, we want to determine which of these poses the greatest risk. So we look at safety, we look at airway, breathing, circulation, all of those things to determine which of these poses that big risk. And lastly, on number 5 here, we had a select all that apply. And our tip here was to make them more approachable, looking at each option as kind of its own true or false statement. So when I look at this here, I can say true or false, a client experiencing hypothyroidism would potentially have bradycardia. And just taking that down the list. And again, if something I determine is false, we can just cross it out. So we are now, looks like, going to take questions, I think. Do we have any questions to take?
So one of the questions that we got earlier, which I think was a really good question, and I wanted to kind of hold off, so I think we need to just kind of talk through it. Mm-hmm. Someone asked, say, hey, when I'm in the question bank, how do I find these test plan categories? And that's a great question, because right now when you go in the question bank, you find items kind of sorted by how you would see them in nursing school. Mm-hmm. But one of the best ways to find them, because if you don't pass your NCLEX on the first time, they'll send you out a score report and let you know here, based on our test plan categories, here's the areas where you struggled. So that's helpful. And then also, if you're studying for your NCLEX, you definitely need to be using the test plan and getting familiar with those test plan categories. I'm trying to pull up because I have a list. Yes, so definitely if you've never seen the test plan before, you can just Google NCLEX test plan. It's on the NCLEX-PN website. They update it on a regular basis, and so you can find the most updated version on there. And then, like I said, one of the best things you can do is just kind of get familiar with the test plan. But I wanted to go through, can you pull up actually the test plan categories? I think that would be super helpful, Holly.
I think I can if you would like to.
Like I said, if anybody just Googles NCLEX test plan, it'll be easily found.
Would you like me to just pull up the test plan itself, or would you like me to?
Awesome. And so then if you scroll down, there's that pie chart on there, and it gives you an idea. And again, this is published by the NCLEX-PN. UWorld did not make this at all. This is straight from the NCLEX-PN. They will tell you, hey, what am I going to see on my NCLEX? So there's a nice little colorful pie chart there. And if you zoom in a little bit, you can see what am I expected to know for each of those categories that I'll be asked on the NCLEX. So when you're looking to find these items in our bank to study, it's kind of helpful to match them up. So you can see like pharmacological and parental therapies, that's pretty easy. In UWorld, you can see we have a category called pharmacology. Something like reduction of risk potential, it's helpful to scroll, you don't need to scroll down, but it's helpful to kind of look and see like, what does that mean? What's under that category? A lot of times it's something safety related, like can you safely perform a skill? By doing it safely, we're reducing the risk of injury to our client. And then also like maybe some assessments, and then something like recognizing changes in a client. These are things that relate to reduction of risk potential. So with that in mind, when you're trying to figure out where do I find these questions on UWorld, the fundamentals is a good place to go, because we do talk about, how do you do these basic skills and how do you perform assessments in that category. And then there are other categories like the physiological adaptation category, and then reduction of risk potential kind of has some similar themes there, where they just sort of fall across lots of different practice areas like adult health, child health, maternal and newborn health. In all of these practice areas, you're going to see instances where you need to know how to manage a disease process, which is kind of under physiological adaptation. So those can be found scattered across. And then there's basic care and comfort. A lot of that stuff is found in the UWorld fundamentals category. Psychosocial integrity is pretty straightforward. We have a mental health category. Health promotion and maintenance, that's related to, how do we prevent illnesses? And again, it's helpful to go down there and see like, what does that mean? What's under health promotion and maintenance? But you can find questions like that, again, kind of scattered throughout adult health, child health, and maternal and newborn health, because teaching and helping, promote health in our clients a lot of times falls throughout those lifespan categories. So I just wanted to kind of throw that in there, because I know that's a question that came up a few times. When we go to conferences, students often ask like, hey, how do I find this stuff? Because I know what the NCLEX wants me to know. How do I find that in your bank? And it's definitely something we've talked about as an alternative way to build an exam in our app. And we definitely want feedback on that, because we think that's something that could be useful. Makes it a little bit harder to track your performance, because right now you can see your performance based on their current categories. So it could make it confusing, but so there's a little tidbit. Go ahead, read the test plan, make sure you know what's under those categories, and then it'll help you find it in the bank.
And I'd also like to point out that on the test plan here with this distribution of content, the self-assessments that UWorld offers, we try to make them match these percentages pretty well. And so that way, when you take that self-assessment exam and you get that score predictor at the end, it is going to be pretty accurate in terms of how you will actually be performing on the NCLEX, because we've asked the similar breakdown of categories with questions. And so the test plan is how we write a lot of our questions here at UWorld. It's how we determine what needs to be included and not included. The lab values we talked about. I think I saw some comments before the stream started discussing EKGs. And I'd like to point out that the required rhythms are also in here. So if you want to look for those, there's not too many of them. But other than that, I think we'll see if we have any other questions that wanted to be answered. Okay, well, it looks like that was kind of our only one we were going to address on here. hopefully you're able to get some address. And if not, we would love for you to reach out to us on our different social media platforms. Send us an email, any of that. We would love to help you. It's our goal here. We just want to help make things easier for you on the NCLEX. When you're taking your test, we always say at UWorld, we make really hard stuff easy to understand. And that's what we hope we're doing here with you. So we are about out of time. So I just want to say thank you guys so much for joining us today. I really hope this was helpful for you in prepping for your NCLEX. And if you're still in nursing school, I hope this is helpful for you just in your regular studying. Obviously, we answered specific questions, but I hope that some of the ways I laid things out and some of the tips we gave can help you to answer other questions, to study well, and do all those things. So lastly, I want to remind you that UWorld does offer 30, 60, and 90-day subscriptions. So if your test date is coming up next month or later in the summer and you're trying to get that last minute, really high quality studying in, we do have those short-term options available. Of course, we've got self-assessments, all those different ways to help you prepare for your test. So also would like to remind you that next Wednesday, same time, 2 p.m. Central here on YouTube, we will be hosting another live study session. This one will be over, what's it going to be? Physiological Adaptation questions, which is part of the test plan that we just talked about. These are really commonly searched for questions. A lot of people get asked these in nursing school and are like, I don't even know what these are. So we're going to try to demystify that, break it down for you, bring you some more test taking tips, some strategies, different things, and also just a good variety of questions. So also a reminder, this is going to be posted for later, so you can go back, watch things, watch the questions, get the information, all of that. And we're always available on our social platforms, as I said before. So rewatch, share with your friends, all of that. And with that, that's all we've got for today. So again, my name's Holly, one of the nurses here at UWorld. Had a great time bringing this to you today. Can't wait to see you guys again next week here at 2 p.m. on YouTube with our stream. And until then, best of luck and happy studying. Bye, guys.